DEN 121 Dental Hygiene Preclinic Lab Competency. Equipment, identification and usage. Student must attain an 80. Complete the following tasks with treatment gloved hands. 1. Locate both rheostats and place on the floor using foot.
This is the rheostat to the hand pieces, and this is the rheostat for the supplemental equipment.
2. Locate all electrical outlets for the operatory, one on the chair and one under the top cabinets.
The electrical outlet on the chair on this particular unit is located here. Occasionally it can be located on the other side. There is also an electrical outlet here underneath the cabinet.
3. Locate and turn on the master switch.
The master switch is located here.
4. Turn on and off the dental light. Identify the high, medium, and low switch for the light.
Here we are turning on and off. This little silver button here is low, medium, and high. If we could keep the light on medium, that is ideal.
Number 5. Locate the high-speed handpiece water purge button.
The high-speed handpiece water purge button is this little silver button here. If you will just push it in, and notice water was expelled from the handpiece hose.
6. Raise and lower the bracket tray.
So on the little handle here, there's a little silver button. You just press it in and raise and lower.
Locate the water switch to handpieces. This is the toggle on the rheostat.
So on the rheostat, you will notice a little toggle switch. It can be flicked back and forth with your foot to supply water to the high-speed handpiece hose. You want to make sure that the toggle is flipped to the little blue dot, and that will supply water.
Number 8. Locate water and air hookup for supplemental equipment such as ProfiJet ultrasonic.
So this little shelf will hold your supplemental equipment, and if you will notice, there is an air hookup here and a water hookup here. You always want to make sure that the water is a blue hose, that it is connected correctly into the water hookup.
Number 9. Locate the on-off switch to the unit ProfiJet ultrasonic.
In this particular unit, this is a Cavitron Jet Plus. Some of our units have other supplemental equipment. Depending on the equipment in your operatory, you will need to be able to locate the on-off button. On the Cavitron Plus, it is located just under the front here.
Number 10. Locate the dental unit water bottle and filter.
So this is the dental unit water bottle. It just screws on and off. This is the filter. It gets changed once a year. And we'll just put it back on.
Number 11. Demonstrate attaching high-speed handpiece. Remove, activate, and replace the high-speed handpiece.
So this will be your high-speed handpiece. As hygienists in North Carolina, we do not use this, but this is something that your dentist will use. So the high-speed handpiece hose is the farthest from you. Just screws on the bottom here. And I want to make sure I have water coming through, so I have my toggle switch. And you will notice water coming out. And then we will place it back.
Number 12. Demonstrate attaching the slow speed handpiece. Remove, activate, and replace the slow speed handpiece.
So this is a slow speed handpiece. This is what we will be using as hygienists to provide Profi Cup polishing for our patients. The slow speed handpiece switch is located closest to you, closest to the operatory chair. We'll insert, screw is on, and notice when we activated the high-speed handpiece, we had water coming through the unit. You do not want water coming through your slow-speed handpiece. So we're going to turn the toggle off. Always make sure this is off, and then we're going to activate it and replace.
Number 13. Demonstrate how to insert the air-water tip into unit housing. Remove, activate, and replace both air-water syringe tips.
So each operatory will have an air-water syringe holder. So you want to push down on the yellow, insert, and you'll hear it click, and then it holds the air-water syringe tip. And to activate, you'll notice there's a little diagram, there's a little puff of air. So press the button for air, and you'll notice there's a little droplet of water. Press the button for water, replace, and you'll notice there's one here on the operator side and here on the assistant side.
14. Demonstrate how to attach the high-volume suction hose. Remove, activate, and replace the high-volume suction.
So this will be the high volume suction. This is the high volume holder located on the assistant side. If you'll notice, there's a little hole here in the top of the suction. This will go inside the patient's mouth. So you will insert firmly, activate by pulling down on the lever. Some of these are a little difficult, so you may have to use a little pressure and then return.
15. Demonstrate how to insert the saliva injector tip into the unit housing. Remove, activate, and replace saliva ejector hose.
So this is the saliva ejector hose. This is what you'll use to suction your patient. It's a screw-in unit, so you'll take the tip, screw it in. This holds into the housing, making sure that it doesn't come out. Activate it the same way with the little lever, and then replace.
16. Disassemble the saliva ejector end. This area needs to be cleaned with brushes and/or cotton swabs located in sterilization room at the end of each week of use.
So we will disengage the silver. And if you'll notice, there's red here. This is when we use our disclosing solution. So inside the housing, you will use a brush or cotton swab to clean this out. And then reattach.
17. Locate the unit suction filter. This will be changed at the end of the semester or as needed. New filters are located in the sterilization room.
This is the suction filter. I'm going to turn my unit off. See if I can get this out. This little trap can be replaced, if you'll notice how dirty that is. We replace those at the end of every semester, or sooner if need be.
18. Lower and raise the dental chair.
You can lower and raise the dental chair 2 places, one here on the operator side. There is an up and a down button. And you have the same up and down buttons here on the assistant side.
Number 19, tilt the chair back and return to an upright position.
Back and forward. Same equipment, same buttons here on the assistant side.
20, adjust, lengthen, and shorten the headrest.
In some of our operatories, this is very tight, so you may need to have help loosening that. Lengthen, shorten, and you can adjust this for patient comfort.
21, lower and raise the armrest. 22, locate and operate the operator stool using adjustment knobs and handles.
So in each operatory, there are different operator stools. On this particular operator stool, each stool will have a lower and higher adjustment. Some stools have a back rest adjustment. It depends on the chair that you might have in your unit.
23, locate the plastic barriers, tray covers, patient napkins, foil, suction tips, etc.
So there are lots of places that you will have armamentarium. The first place will be inside the cabinet. Will be tray covers, masks, patient bibs, lunch lady gloves, bonnets, plastic wrap, wax paper, cups, foil. In the second drawer down, you will find everything that you will need to attach to your chair. This is where you'll find the high-speed suction tips, slow-speed suction, Profi paste, gauze, Dappen dishes, air water syringe tips. And in the bottom drawer, you will find barriers, chair covers, and then also over here, this is one of our plastic barriers.
24, locate on and off switch to computer and monitor.
Here is the on-off switch for the monitor. The computer switch is located on the lower right of the monitor.
25, locate mouse and keyboard.
The mouse and keyboard is housed in the top drawer. In some operatories, we have wireless mice. They are operated by battery, on, off. You want to make sure that if you have a battery-operated mouse, that you, when you replace it at the end of every day, that you turn it off. You may also find, depending on your unit, a mouse that will sit and be housed in a charger.
26, locate and demonstrate use of pull-out desk.
And this is your pull-out desk. Has a few instructions here. That's for your use when you're working on your patient.
27, locate the disinfectant wipes.
Disinfectant wipes are kept over here in the left-hand corner.
28, locate soap dispenser. Demonstrate operation with elbow.
Here is your soap dispenser, and to use the soap dispenser, you will operate with your elbow. Push the bar in.
29, locate the sharps container.
The sharps container is, we have one sharps container in every bay. You will find that located here in the end on the cart. It is red.
30, locate the patient education materials.
You will find patient education materials located in several places in our clinic. In your operatory, you may find patient education materials on the chase. You will also find patient education materials located as you're going toward the locker room. We have a variety of education materials.
31, Locate the view box. This is only used if patient has recent film radiographs.
So the view box will either be housed up here on top of the cabinet or in the cabinet. In our digital age, we rarely have patients who present with traditional film radiographs, but just in case, you should find that located somewhere in your operatory. If not, we have view boxes you can borrow from us.
32. Locate trash receptacle.
This is your trash receptacle. It's housed under the cabinet.
33. Locate towel dispenser.
This is your towel dispenser. Pull down.